Section 21. Match. 1. Rehabilitation. The answer is L. Care that is managed by professionals to help restore a person. 2. Trapeze. H. Triangular piece of equipment that hangs over the head of the bed. 3. Prosthesis. The answer is F. Device that replaces a body part. 4. ROM. The answer is O. Exercise that puts a joint through its full arc of motion. 5. PROM. The answer is A. Used when resident cannot move on their own. 6. AROM. The answer is B. Performed by resident himself. 7. AAROM. The answer is N. Done by the resident with some assistance. 8. Abduction. The answer is C. Moving body part away from the midline of the body. 9. Adduction. The answer is D. Moving body part towards the midline of the body. 10. Dorsiflexion. The answer is E. Bending backward. 11. Rotation. The answer is G. Turning a joint. 12. Extension. The answer is I. Straightening a body part. 13. Flexion. The answer is J. Bending a body part. 14. Pronation. The answer is M. Turning downward. 15. Supination. The answer is K. Turning upward. Fill in the blank. Incentive spirometer. Lungs. Increase circulation. Belts, cuffs, or suction. Trapeze. Plate guard. Lower. High blood pressure. Physical and mental health. Rehabilitation. 16. Blank and restorative care is one of the great joys of working as a caregiver. The answer is rehabilitation. 17. Exercise is important for improving and maintaining blank and blank health. The answer is physical and mental health. 18. Exercising with blank can be risky. The answer is high blood pressure. 19. Cool down exercises are done to slowly blank the heart rate. The answer is lower. 20. Blank prevents food from being pushed off the plate and makes it easier to scoop food onto utensils. The answer is plate guard. 21. People in bed can grasp a blank with their hands, which enables them to lift themselves. The answer is trapeze. 22. Most artificial limbs are attached by blank. The answer is belts, cuffs, or suction. 23. The goal of ROM is to decrease or prevent contractures, improve strength, and blank. The answer is increase circulation. 24. Deep breathing exercise can help expand the blank, clearing them of mucus and preventing infections. The answer is lungs. 25. Blank are used for deep breathing exercises. The answer is incentive spirometers. Section 22. True and false. 1. Subacute care is a kind of specialized care that falls between acute care and long-term care. The answer is true. 2. Dialysis cleanses the body of waste that the kidneys cannot remove due to chronic kidney failure. The answer is true. 3. Anesthesia medication does not help pain. The answer is False. 4. Before surgery, there will be an order for the patient to eat as much as they want. The answer is false. 5. A person who is having surgery will require preoperative physical preparation as well. The answer is true. 6. NPO means you can have water but no food. The answer is false. 7. Postoperative care begins right after surgery. The answer is false. 8. A pulse oximeter is an invasive device that uses a light to determine the amount of oxygen in the blood. The answer is false. 9. Normal blood oxygen level usually measures between 95% and 100%. The answer is true. 10. Telemetry is used to measure the heart rhythm and rate on a continuous basis. The answer is true. 11. An artificial airway is any plastic, metal, or rubber device inserted into the respiratory tract to maintain or promote breathing. The answer is true. 12. There is only one type of artificial airway. The answer is false. 13. A sensor is a clip on a person's finger, earlobe, or toe. The answer is true. Fill in the blank. Doctor. Nostrils flaring. Membrane covers, protects. Constipation. Compassionate. Pleural cavity. Chest tube. Mucus secretions. Sedative. Larynx. Mechanical ventilation. Tracheostomy. 14. One type of artificial airway is a blank. The answer is tracheostomy. 15. Blank is using a machine to assist with or replace breathing when a person is unable to do this on their own. The answer is mechanical ventilation. 16. The vocal cord is also called the blank. The answer is larynx. 17. A blank is an agent or drug that helps calm and soothe a person and may cause sleep. The answer is sedative. 18. Suctioning removes blank and blank from the lungs. The answer is mucus secretions. 19. Blank are hollow drainage tubes that are inserted into the chest during a sterile procedure. The answer is chest tubes. 20. The blank is the space between the layers of the pleura. The answer is pleural cavity. 21. Patients often have many worries before surgery, but a blank response by staff may help alleviate concerns. The answer is compassionate. 22. Complications of surgery can also include urinary retention or infections, blank, blood pressure variants, and blood clots. The answer is constipation. 23. The pleura is a thin blank that blanks and blanks the lungs. The answer is membrane, covers, protects. 24. Signs of respiratory distress include blank. The answer is nostrils flaring. 25. A blank normally inserts test tubes. The answer is doctor. Section 23. 1. A blank is a disease or condition that will eventually cause death. A. Stroke. B. Denial. C. Terminal illness. D. None of the above. The answer is C. 2. Who researched and wrote about the grief process? A. Elizabeth Kubler-Ross. B. Abraham Maslow. C. Eric Erickson. D. Rick Dixon. The answer is A. 3. Which of the following includes the 5 stages of death and dying? A. Denial, shock, anger, guilt, depression. B. Denial, anger, bargaining, depression, acceptance. C. Anger, depression, regret, loneliness, pain. D. Pain, hunger, thirst, guilt, fear. The answer is B. 4. Slow, irregular respirations or rapid, shallow respirations are called blank. A. Cheryl Stokes. B. Cherry Stokes. C. Chin Stokes. D. CNA Stokes. The answer is D. 5. When the muscles in the body become stiff and rigid, this is called A. Rigor mortis. B. Reggae mortis. C. Roger mortis. D. Rogaine mortis. The answer is A. 6. Blank is care of the body after death. A. Premortem care. B. Palliative care. C. Personal care. D. Postmortem care. The answer is D. 7. Rigor mortis is a blank for stiffness of death. A. Greek word. B. Latin word. C. French word. D. German word. The answer is B. 8. Which of the following is the removal of organs and tissues for the purpose of transplanting into someone who needs them? A. Organic donation. B. Organ donation. C. Organ donation. D. Oregano donation. The answer is C. 9. PCA means blank. A. Patient-controlled analgesia. B. Patient care analysis. C. Patient comfort analysis. D. None of the above. The answer is A. Match the following. 10. Denial. The answer is H. Denying or refusing to believe we are grieving. 11. Anger. The answer is K. We may be angry with ourselves or God. 12. Bargaining. The answer is J. Make promises to God. 13. Depression. The answer is I. Cry or withdraw. 14. Acceptance. The answer is G. Plan for their last days or ceremony. 15. Shock. The answer is A. May be surprise of the death of our loved ones. 16. Regret. The answer is B. May regret things we said or did not say. 17. Sadness. The answer is C. We may cry or feel emotionally unstable. 18. Loneliness. The answer is D. Missing someone who has died. 19. Cultural background. The answer is E. The practices we grow up with. 20. Advanced directive. The answer is F. Allow people to choose what medical care they want or do not want. True and false. 21. A person who is dying may become depressed and withdrawn. The answer is true. 22. The goal of hospice are comfort and dignity of the resident. The answer is true. 23. Being a good listener can be a great help to a dying resident and his or her family. The answer is true. 24. A DNR tells medical professionals to perform CPR. The answer is false. 25. A dying resident's room should be softly lit without glare. The answer is true. Section 24. Fill in the blank. Improve. Constructive. Polite. Internet. Health. Regularly. Proud. Support. Tolerance. Stressor. Stress. 12 hours. OBRA. Suggestions. Criticism. B. C. Job description. Lie. Criminal. Resume. Called. Potential. Hands-on. Lab technicians. Direct service. 1. Nursing assistants, doctors, and nurses all provide blank. The answer is direct service. 2. Blank may conduct tests to help diagnose a condition. The answer is lab technicians. 3. Chiropractors perform blank manipulations or adjustments of the spine or other joints. The answer is hands-on. 4. To find a job, you must first find blank employers. The answer is potential. 5. References are people who can be blank to recommend you as an employee. The answer is called. 6. A blank is a summary or listing of relevant job experience and education. The answer is resume. 7. Never blank on your job application. The answer is lie. 8. By law, employers must perform a blank background check on all new aides hired. The answer is criminal. 9. A blank is an agreement between the employer and the employee. The answer is job description. 10. Hepatitis blank and blank are blood-borne diseases that can cause death. The answer is B and C. 11. Handling blank is hard for most people. The answer is criticism. 12. Ask for blank when receiving constructive criticism. The answer is suggestions. 13. Blank requires that each state keep a registry of nursing assistants. The answer is OBRA. 14. The federal government requires that nursing assistants have blank of continuing education. The answer is 12 hours. 15. Blank is a state of being frightened, excited, confused, in danger, or irritated. The answer is stress. 16. Something that causes stress is a blank. The answer is stressor. 17. Your blank of stress depends on your personality, life experiences, and physical health. The answer is tolerance. 18. Blank groups can help you deal with different types of stress. The answer is support. 19. Be blank of the work you have chosen to do. It is important. The answer is proud. 20. Exercise blank is one way to decrease stress. The answer is regularly. 21. Blank educators and prevention professionals teach the general population or specific populations. The answer is health. 22. Searching the blank is one good way to find a job. The answer is internet. 23. Be blank and make eye contact while interviewing. The answer is polite. 24. Hostile criticism and blank criticism are not the same thing. The answer is constructive. 25. Constructive criticism is meant to help you blank. The answer is improve. Section 25. 1. Mucus from the respiratory system that is expectorated from the mouth is called A. Hemoptysis, B. Acetone, C. Melena, D. Sputum. The answer is D. 2. Specimens are collected and tested for the following reasons, except A. To prevent disease, B. To detect disease, C. For urine control, D. To treat disease. The answer is C. 3. Who orders what specimen to collect and the test needed? A. Nurse aide, B. Doctor, C. Receptionist, D. Resident's family. The answer is B. 4. Which one is not a rule for collecting specimens? A. Use only one container for different specimens. B. Follow the rules of medical asepsis. C. Label the container. D. Do not touch the inside of the container or lid. The answer is A. 5. Urine specimens are collected for A. Terry stool test, B. Sputum, C. Blood test, D. Urine test. The answer is D. 6. Before collecting a urine specimen, you need the following information from the nurse except A. The type of specimen needed, B. What time to collect a specimen, C. How the lab will test the specimen, D. What special measures are needed. The answer is C. 7. The midstream specimen is called blank. A. A sterile voided specimen, B. A clean voided specimen, C. Acetone specimen, D. Ketone specimen. The answer is B. 8. All urine voided during a 24-hour period is collected for blank. A. A 24-hour urine specimen, B. 12-hour urine specimen, C. Double voided specimen, D. Random specimen. The answer is A. 9. Urine tested for ketones are usually collected A. Before breakfast, B. 30 minutes after meals and at bedtime, C. 30 minutes before meals and at bedtime, D. At midnight. The answer is C. 10. Stools are black and tarry if there is bleeding in the A. Intestine, B. Vagina, C. Heart, D. Stomach or upper GI tract. The answer is D. 11. Surgery done by choice to improve the person's life or well-being is called A. Urgent surgery, B. Emergency surgery, C. Elective surgery, D. General surgery. The answer is C. 12. Joint replacement surgery and cosmetic surgery are what type of surgery? A. General surgery. B. Elective surgery. C. Emergency surgery. D. Urgent surgery. The answer is B. 13. The type of surgery that is sudden and unexpected is blank. A. Emergency surgery. B. Bypass surgery. C. General surgery. D. Urgent surgery. The answer is A. 14. The introduction of fluid into vagina and the immediate return of the fluid is called A. Anesthesia. B. Thrombus. C. Embolus. D. Douche. The answer is D. 15. Which is not a common fear and concern of surgical patients? A. Pain during surgery. B. Dying during surgery. C. Comfort after surgery. D. Waking up during surgery. The answer is C. 16. Regional anesthesia means A. Loss of consciousness and all feeling. B. Loss of feeling or sensation in a large area of the body. C. Loss of feeling or sensation produced by a drug. D. Loss of feeling or sensation produced by a drug. The answer is B. 17. Preoperative drugs are given to patients about blank minutes to 1 hour before surgery. A. 45. B. 30. C. 48. D. 20. The answer is A. 18. Preoperative drugs are given to the patient for the following reasons, except A. To help the person relax and feel drowsy. B. To stop the person from dying. C. Reduce respirations, secretions, and to prevent aspirations. D. To prevent nausea and vomiting. The answer is B. 19. A doctor who specializes in giving anesthetics is called A. Podiatrist. B. Social worker. C. Physical therapist. D. An anesthesiologist. The answer is D. 20. As CNA to help prevent respiratory and circulatory complications after surgery, you should reposition the patient at least A. 96H. B. Q4H. C. Q2H. D. Q3H. The answer is C. 21. When preparing surgical patient bed, you should do the following except A. Make a surgical bed. B. Keep the bed to its lowest position. C. Lower bed rails. D. Move furniture out of the way for stretcher. The answer is B. 22. Elastic stockings are ordered for the people at risk of thrombi. Which patient is not at risk of thrombi? A. Pregnant women. B. Obese patients. C. Surgical patients. D. None of the above. The answer is D. 23. Elastic stockings are also called A. Leg wear. B. Elastic bandages. C. Anti-embolism stockings. D. Pressure stockings. The answer is C. 24. Preoperatively, Mr. Leon is blank. A. Given a tube feeding. B. NPO. C. Allowed only milk. D. Allowed only water. The answer is B. True and false. 25. The goal of preoperative care is to prevent complications before, during, and after surgery. The answer is true. 26. Surgery is done to remove a diseased body part or repair injured tissue. The answer is true. 27. Surgery often requires a hospital stay. The answer is true. 28. Women can wear artificial nails to surgery. The answer is false. 29. Turning and repositioning are done every 3 to 4 hours after surgery. The answer is false. 30. An anesthetist is an RN with advanced study given anesthetics. The answer is true. 31. Artificial eyes and artificial limbs are removed before surgery. The answer is true. 32. Some surgeries require certain positions. The answer is true. 33. A surgical cap keeps hair out of the face and operative site. The answer is true. 34. Jewelry is worn to the operating room. The answer is false. 35. A full bladder can cause discomfort during a douche. The answer is true. 36. An open wound on the lower leg and feet caused by decreased blood flow through the arteries or veins is A. Arterial ulcer. B. Decubitus ulcer. C. Circulatory ulcer. D. Pressure ulcer. The answer is C. 37. Thin watery drainage that is blood-tinged is called A. Sanguineous drainage. B. Purulent drainage. C. Serous drainage. D. Serosanguinous drainage. The answer is D. 38. Which is not a type of wound? A. Abrasion. B. Gangrene. C. Laceration. D. Contusion. The answer is B. 39. Partial thickness wound caused by the scraping away or rubbing of skin is called A. Incision. B. Puncture wound. C. Abrasion. D. Penetrating wound. The answer is C. 40. Violent act that injures the skin, mucous membranes, bones, and internal organs is A. Trauma. B. Wound. C. Shock. D. Skin tear. The answer is A. 41. Tissues are injured but the skin is not broken. This is called what? A. Clean wound. B. Closed wound. C. Contaminated wound. D. Puncture wound. The answer is B. 42. Dehiscence means A. Infected wound. B. Wounds with large amount of microbes. C. Wounds that does not heal easily. D. Separation of wound layers. The answer is D. 43. A pressure ulcer can also be called A. Decubitus ulcer. B. Vascular ulcer. C. Venous ulcer. D. Chronic ulcer. The answer is A. 44. An area where the bone sticks out or projects out from the flat surface of the body is called A. Bed sore. B. Pressure sore. C. A bony prominence. D. Contusion. The answer is C. 45. Which one is not a bony prominence? A. Shoulder blades. B. Sacrum. C. Ankles. D. Ear. The answer is D. 46. Common causes of skin breakdown and pressure ulcers include the following except A. Friction. B. Shock. C. Shearing. D. Pressure. The answer is B. 47. The bony areas are called A. Bed sore. B. Pressure sore. C. Pressure points. D. Pressure stage. The answer is C. 48. At the first stage of the pressure ulcers, the skin is blank. A. Cyanosis. B. Red. C. Peels. D. Cracks. The answer is B. 49. Which is not a measure in preventing pressure ulcers? A. Positioning the person according to the care plan. B. Raising the head of the bed to the highest position. C. Providing good skin care. D. Minimizing skin exposure to moisture. The answer is B. 50. Measures to prevent circulatory ulcers include the following, except A. Keeping pressure on the heels and other bony areas. B. Do not massage over pressure points. C. Keeping linens clean, dry, and wrinkle-free. D. Dressing the person in tight clothes. The answer is D. 51. Heat and cold application for promoting healing and comfort is ordered by A. Doctor. B. Nurse. C. CNA. D. Receptionist. The answer is A. 52. Bluish skin color is A. Syncope. B. Arrhythmia. C. Jaundice. D. Cyanosis. The answer is D. 53. A body temperature is much larger than the person's normal. This is called A. Hypothermia. B. Hyperthermia. C. Low blood pressure. D. Blood pressure rate. The answer is B. 54. Heat applications are often used for A. Circulatory problems. B. Musculoskeletal injuries. C. Nervous injuries. D. Heart injuries. The answer is B. 55. Which is not a reason for heat application? A. To relieve pain. B. To increase joint stiffness. C. To reduce tissue swelling. D. To relax muscles. The answer is B. 56. What type of application has greater and fasten effects? A. Dry heat application. B. Non-dry application. C. Heat application. D. Moist heat application. The answer is D. 57. A cold application is usually between A. 50 degrees to 65 degrees Fahrenheit. B. 98 degrees to 106 degrees Fahrenheit. C. 100 degrees to 106 degrees Fahrenheit. D. 40 degrees to 50 degrees Fahrenheit. The answer is A. 58. Heat and cold are applied for not longer than A. 2 to 5 minutes. B. 5 to 10 minutes. C. 15 to 20 minutes. D. 10 to 15 minutes. The answer is C. 59. A very hot application is applied only by A. Charge nurse. B. Nursing assistant. C. Physical therapist. D. Occupational therapist. The answer is A. 60. Very hot application is usually between A. 95 degrees to 106 degrees Fahrenheit. B. 106 degrees to 120 degrees Fahrenheit. C. 105 degrees to 106 degrees Fahrenheit. D. 106 degrees to 115 degrees Fahrenheit. The answer is D. 61. The sitz bath usually lasts for A. 5 minutes. B. 20 minutes. C. 45 minutes. D. 50 minutes. The answer is B. 62. An electric device used for dry heat is A. Compress. B. Compass. C. The aquakermia pad. D. Hypothermia pad. The answer is C. 63. Which one is not a sign and symptom of hypoxia? A. Dizziness. B. Confusion. C. Rash. D. Fatigue. The answer is C. 64. Hypoxia means blank. A. Rapid breathing. B. Insufficient oxygen to the cells. C. Slow breathing. D. Abnormal breathing. The answer is B. 65. Smoking causes A. Lung cancer. B. Breath cancer. C. Kidney failure. D. Heart cancer. The answer is A. 66. An early sign of hypoxia is A. Apprehension. B. Agitation. C. Cyanosis. D. Restlessness. The answer is D. 67. Breathing deeply and comfortably only when sitting is called A. Dyspnea. B. Orthopnea. C. Apnea. D. Bradypnea. The answer is B. 68. Slow, weak respirations at not fewer than 12 per minute is A. Cheyenne-Stokes respirations. B. Byat's respiration. C. Respiratory depression. D. Respiratory arrest. The answer is C. 69. Pulmonary function test measures A. The amount of oxygen in the blood. B. The amount of hemoglobin containing oxygen. C. The amount of air moving in and out of the lungs. D. How much air the heart can hold. The answer is C. 70. A chest X-ray is taken to detect A. Blood damage. B. Lung damage. C. Kidney damage. D. Liver damage. The answer is B. 71. A substance that gives off radiation is called A. Bronchoscopy. B. Thoracentesis. C. Radiation. D. Radioisotope. The answer is D. 72. Pulse oximetry measures A. Oxygen concentration in arterial blood. B. The amount of brain damage. C. The capacity of air the lungs can hold. D. Measures progress of lungs disease. The answer is A. 73. Breathing is usually easier in what type of position? A. Sims position. B. Prone position. C. Fowler's position. D. Supine position. The answer is C. 74. Factors affecting oxygen needs include A. Respiratory system status. B. Aging. C. Pain. D. All of the above. The answer is D. 75. People with difficulty breathing often prefer sitting up and leaning over a table to breathe. This is called A. Dorsal recumbent position. B. Knee-chest position. C. Orthopneic position. D. Lithotomy position. The answer is C. 76. Position changes are needed for at least A. Q6H. B. Q2H. C. Q3H. D. Q8H. The answer is B. 77. You are assisting a patient with coughing and deep breathing. Which is incorrect? A. The person inhales through pursed lips. B. The person sits in comfortable position. C. The person holds a follow over air incision. D. The person inhales deeply through the nose. The answer is A. 78. The collapse of a portion of the lungs is called A. Pneumonia. B. Dizziness. C. Atelectasis. D. Disorientation. The answer is C. 79. A spirometer is a machine that measures A. The movement of air. B. The amount of air moving out of the lungs. C. The volume of air exhaled. D. The amount of air inhaled. The answer is D. 80. The amount of oxygen to give and the device to use can only be ordered by blank. A. CNA. B. Doctor. C. RN. D. LVN. The answer is B. 81. Oropharyngeal airway is inserted through A. Nostril and into the pharynx. B. Nose and into the trachea. C. The mouth and into the pharynx. D. The surgically created opening into the trachea. The answer is C. 82. Which one is not the upper part of the airway, upper respiratory tract? A. Mouth. B. Pharynx. C. Mouth. D. The trachea. The answer is D. 83. Infection of the middle ear is called A. Otitis media. B. Deaf. C. Cerumen. D. Braille. The answer is A. 84. Otitis media is common in blank. A. Young people. B. Old people. C. Infants. D. Adults. The answer is C. 85. A chronic disease of the inner ear is blank. A. Tinnitus. B. Otitis media. C. Acute ear disease. D. Meniere's disease. The answer is D. 86. The middle ear contains eustachian tube and 3 small bones called A. Eardrum. B. Tympanic membrane. C. Ossicles. D. Auditory canal. The answer is C. 87. Difficulty in hearing normal conversation is blank. A. Deafness. B. Hearing loss. C. Vertigo. D. Cerumen. The answer is D. 88. Hearing loss in which it is impossible for the person to understand speech through hearing alone is blank. A. Hearing loss. B. Deafness. C. Tinnitus. D. Otitis media. The answer is A. 89. The most common cause of hearing loss in children is A. Illness. B. Birth defects. C. Ear infection. D. Injury. The answer is C. 90. Symptoms of hearing loss in children and adults include A. Speaking too loudly. B. Leaning forward to hear. C. Asking for words to be repeated. D. All of the above. The answer is D. 91. Communicating with a hearing impaired person includes the following except A. Position yourself at the person's level. B. Turn your back when speaking with the person. C. Stand or sit in good right. D. Speak clearly, distinctly, and slowly. The answer is B. 92. The second layer of the eyes is called A. The sclera. B. The retina. C. The choroid layer. D. Optic nerve. The answer is C. 93. The major cause of vision loss is blank. A. Cataracts. B. Infections. C. Glaucoma. D. Hereditary. The answer is C. 94. Hearing aids make A. Sounds louder. B. Speech clearer. C. Correct hearing disorder. D. Increase background noise. The answer is A. 95. Braille involves A. Ringing in the ears. B. Raised dots arranged for letters of the alphabet. C. Dizziness. D. Audiobooks. The answer is B. 96. CNA can provide safety for blind clients by doing the following except A. Turning on lights. B. Keeping doors open or closed. C. Having client stand in the middle of room. D. Informing the client of steps and curbs. The answer is C. 97. When communicating with the speech impaired, you should do the following. A. Listen and give the person full attention. B. Determine the subject being discussed. C. Repeat what the person has said. D. All of the above. The answer is D. 98. Blank is a disease affecting the blood vessels that supply blood to the brain. A. Angina pectoris. B. Myocardial infarction. C. Stroke. D. Heart attack. The answer is C. 99. The third leading cause of death in the United States is blank. A. Heart attack. B. Cerebrovascular accident. C. Diabetes. D. Obesity. The answer is B. 100. The surgical creation of an artificial opening between the ureter and the abdomen is called A. Ureterostomy. B. Ileostomy. C. Bosomy. D. Colostomy. The answer is A. 101. High sugar in the blood is called A. Hypoglycemia. B. Diabetes mellitus. C. Sugar surge. D. Hyperglycemia. The answer is D. 102. Blank is a tumor that grows fast and invades other tissues. A. Fast tumor. B. Malign tumor. C. Benign tumor. D. Metastasis. The answer is B. 103. The removal of all or part of an extremity is blank. A. Amputation. B. Decapitation. C. Evisceration. D. Cutting. The answer is A. 104. Which therapy helps the immune system? A. Hormone therapy. B. Chemotherapy. C. Biological therapy. D. Radiation therapy. The answer is C. 105. The followings are the side effect of hormone therapy except A. Weight gain. B. Fatigue. C. Hot flashes. D. Muscle aches. The answer is D. 106. Leukemia is the most common type of blank in children. A. Myocardial infarction. B. Cancer. C. Pneumonia. D. Stroke. The answer is B. 107. Which of the followings can be a care for people with paralysis? A. Keep the bed in low position. B. Follow bowel and bladder training programs. C. Maintain good alignment at all times. D. All of the above. The answer is D. 108. Blank is spread by airborne droplets with coughing, sneezing, speaking, and singing. A. Pneumonia. B. Leprosy. C. Asthma. D. Tuberculosis. The answer is D. 109. The leading cause of death in the United States is blank. A. Coronary artery disease. B. Pneumonia. C. HIV. D. Angina. The answer is A. 110. Which of the following is a major complication of CAD? A. Emphysema. B. Dyspnea. C. Tuberculosis. D. Myocardial infarction. The answer is D. 111. Blank occurs when the heart cannot pump blood normally. A. Hypertension. B. Congestive heart failure. C. Hypotension. D. None of the above. The answer is B. 112. Blood clot is also known as blank. A. Bronchus. B. Thrombus. C. Blood stop. D. Platelets. The answer is B. 113. The therapy that involves drugs that kill cells is called A. Hormone therapy. B. Biological therapy. C. Chemotherapy. D. Physiotherapy. The answer is C. 114. Using X-ray beams to destroy cancerous cells is blank therapy. A. Radiotherapy. B. Physiotherapy. C. Chemotherapy. D. Biological therapy. The answer is A. 115. Blank is the spread of cancer to other parts of the body. A. Stomatitis. B. Cancer transfer. C. Benign tumor. D. Metastasis. The answer is D. 116. A condition in which there is death of tissue is called A. Aphasia. B. Gangrene. C. Angina. D. Pectoris. The answer is B. 117. Blank is when the bone becomes porous and brittle or is fragile and breaks easily. A. Osteoporosis. B. Arthritis. C. Rheumatoid arthritis. D. Low bone density. The answer is A. 118. Which of the following is not a rule for cast care? A. Turn the person every 2 hours. B. Wash the cast every 4 hours. C. Elevate a casted arm or leg on pillows. D. Protect the person from rough cast edges. The answer is B. 119. Which of the following is not a risk factor of stroke? A. Smoking. B. Obesity. C. Exercise. D. Drug abuse. The answer is C. 120. There are blank major types of hepatitis. A. 5. B. 3. C. 6. D. 4. The answer is A. 121. Diseases that are contagious and infectious are called blank diseases. A. Non-communicable. B. Spreading. C. Communicable. D. Rapid. The answer is C. 122. Which one is a sign and symptom of hepatitis? A. Loss of appetite. B. Fever. C. Nausea and vomiting. D. All of the above. The answer is D. 123. What type of diabetes occurs mostly in children? A. Type 2. B. Type 3. C. Type 1. D. Type 4. The answer is C. 124. Which of these is a sign of chronic renal failure? A. Sudden severe headaches with no known cause. B. Halitosis. C. Rashes. D. Rigidity and trembling of extremities. The answer is B. 125. The pathway created for urine to exit the body by removing the bladder is called blank. A. Urinary diversion. B. Urinary conversion. C. Urinary obstruction. D. Urinary bisection. The answer is A. 126. Cystitis, which is a bladder infection, is caused by blank. A. Virus. B. Fungus. C. Bacteria. D. Nematode. The answer is C. 127. Care of a person with stroke involves the following except: A. The bed is kept in semi-Fowler's position. B. Avoid coughing and deep breathing. C. Food and fluid needs are met. D. Good skin care prevents pressure ulcers. The answer is B. 128. Psychosis means A. A state of severe mental impairment. B. A disorder of the mind. C. Mental disorder. D. Emotional illness. The answer is A. 129. Superego is concerned with blank. A. Ability and disability. B. Mind and stress. C. Right and wrong. D. Health and illness. The answer is C. 130. A vague, uneasy feeling in response to stress is called A. Personality. B. Anxiety. C. Stress. D. Panic. The answer is B. 131. Which one is not a sign and symptom of anxiety? A. Rapid pulse. B. Rapid respiration. C. Increased blood pressure. D. Redness. The answer is D. 132. Any factor that causes stress is called A. Obsession. B. Stress. C. A stressor. D. Phobia. The answer is C. 133. The highest level of anxiety is blank. A. Syncope. B. Panic. C. Dread. D. Terror. The answer is B. 134. Which is not a sign and symptom of depression in older people? A. Diarrhea. B. Paranoia. C. Dry mouth. D. Anxiety. The answer is A. 135. Depression involves the following except A. Body. B. Mood. C. Ability. D. Thoughts. The answer is C. 136. Blank when a person is seeing, hearing, or feeling something that is not real. A. Delusion. B. Hallucination. C. Paranoia. D. Bipolar disorder. The answer is B. 137. Mrs. White believes that she is the Queen of England. This is called a blank. A. Hallucination. B. Paranoia. C. Delusion of persecution. D. Delusion of grandeur. The answer is D. 138. Mr. Smith believes that his food is poisoned. This is called a blank. A. Superego. B. Paranoia. C. Psychosis. D. Delusion. The answer is B. 139. Anorexia nervosa occurs when A. A person has an intense fear of weight gain and obesity. B. Binge eating occurs. C. A person explores his or her thoughts and feelings. D. A person has severe extremes in mood. The answer is A. 140. Repeating an act over and again without the ability to control the repetition is called A. Ego. B. Paraphrasing. C. Compulsion. D. Conscience. The answer is C. 141. Delirium means A. A false belief. B. Loss of conjecture and social function. C. Feeling something that is not real. D. A state of temporary but acute mental confusion. The answer is D. 142. Cognitive functioning includes all except A. Memory. B. Attitude. C. Thinking. D. Reasoning. The answer is B. 143. When caring for a confused person, the CNA should do the following except A. Provide safety. B. Give date and time each morning. C. Rearrange furniture and a person's view. D. Place familiar objects and pictures within the person's view. The answer is C. 144. Loss of cognitive and social function caused by changes in the brain is called A. Dementia. B. Paranoia. C. Obsession. D. Schizophrenia. The answer is A. 145. Alzheimer's disease is A. Heart disease. B. Brain disease. C. Blood disease. D. Liver disease. The answer is B. 146. The most common type of permanent dementia is blank. A. Huntington's disease. B. Parkinson's disease. C. Alzheimer's disease. D. Korsakoff disease. The answer is C. 147. The most common mental health problem in old people is A. Depression. B. Infection. C. Drugs. D. Head injuries. The answer is A. 148. Signs and symptoms of delirium include A. Tremors. B. Delusions. C. Hallucinations. D. All of the above. The answer is D. 149. Mr. Fresh has delusion. Delusion means A. False dementia. B. False belief. C. A state of temporary but acute mental confusion. D. Something that is not real. The answer is B. 150. Signs, symptoms, and behavior of Alzheimer's disease increase during A. Daylight. B. Morning time. C. Early afternoon. D. Hours of dark. The answer is D. 151. The classic sign of Alzheimer's disease is blank. A. Not recognizing objects. B. Gradual loss of short-term memory. C. Agitation. D. Mood and personality. The answer is B. 152. The followings are common in people with Alzheimer's disease except A. Pain, rash, and shock. B. Communication problem, moodiness, and restlessness. C. Memory loss, poor judgment, and poor reasoning. D. Delusion, hallucination, and screaming. The answer is A. 153. When caring for Mr. Stone who is wandering, you should do the following except A. Follow agency policy for locking doors and windows. B. Keep door alarms and electronic doors turned on. C. Involve the person with activities. D. Restrain Mr. Stone firmly. The answer is D. 154. Mr. Jones becomes confused and begins to wander. The CNA should A. Restrain him to prevent injuries. B. Tell the doctor. C. Report his behavior to the charge nurse. D. Tell his family about the behavior. The answer is C. 155. A common sign of depression is A. Laughing and smiling. B. Changes in appetite. C. Socializing with friends. D. Attending activities. The answer is B. 156. A disability occurring before 22 years of age is called a blank. A. Developmental disability. B. Mental retardation. C. Spastic. D. Spinal bifida. The answer is A. 157. Mental retardation involves A. Violent sudden contractions of muscle groups. B. Muscle weakness. C. Low intellectual function. D. Uncontrolled contraction of skeletal muscles. The answer is C. 158. These statements are about cerebral palsy. Which one is false? A. It is a disorder involving muscle weakness or poor muscle. B. It is violent contractions of muscle groups. C. Lack of oxygen to the brain is the usual cause. D. The defect is in the motor region of the brain. The answer is B. 159. Autism begins in early childhood between A. 12 months and 6 years. B. 9 months and 7 years. C. 10 months and 5 years. D. 18 months and 3 years. The answer is D. 160. Paralysis of all four extremities is A. Paraplegia. B. Hemiplegia. C. Quadriplegia. D. Diplegia. The answer is C. 161. Paralysis on one side of the body is A. Quadriplegia. B. Hemiplegia. C. Paraplegia. D. Diplegia. The answer is B. 162. Diplegia means A. That similar body parts are affected on both sides of the body. B. The arm and leg on one side are affected. C. Both arms and both legs are paralyzed, so are the trunks and neck muscles. D. Paralysis of the leg or lower body. The answer is A. 163. People with cerebral palsy have much impairment. They include the following, except A. Mental retardation. B. Learning disabilities. C. Speech impairments. D. Wide flat nose. The answer is D. 164. A chronic condition produced by temporary changes in the brain's electrical function is A. Autism. B. Epilepsy. C. Spina bifida. D. Hydrocephalus. The answer is B. 165. Seizures that occur in one part of the brain is called A. Whole seizures. B. Single seizures. C. Partial seizures. D. Generalized seizures. The answer is C. 166. Spina bifida defects occur during the A. 3 months of pregnancy. B. First month of pregnancy. C. 6 months of pregnancy. D. 5 months of pregnancy. The answer is B. 167. Down syndrome occurs A. First month of pregnancy. B. At fertilization. C. During birth. D. From trauma. The answer is B. 168. Children with Down syndrome have certain features caused by extra chromosomes. They include the following, except A. Drooling. B. Oval-shaped eyes that slant upwards. C. Flat face. D. Short, wide hands with stubby fingers. The answer is A. 169. A seizure can also be called A. Autism. B. Down syndrome. C. Convulsion. D. Spina bifida. The answer is C. 170. Spina bifida involves A. Loss of consciousness. B. A defect of spinal column. C. Hearing impairments. D. Mental retardation. The answer is B. 171. The inability of the male to have an erection is called A. Menopause. B. Impotence. C. Transvestite. D. Transsexual. The answer is B. 172. Erectile dysfunction is the same thing as A. Impotence. B. Menopause. C. Bisexual. D. Transsexual. The answer is A. 173. Menopause is blank. A. When the body responds to stimulation. B. When menstruation stops. C. Reproductive organ. D. Uniting of the sperm and ovum. The answer is B. 174. Menstruation occurs about every A. 20 days. B. 18 days. C. 10 days. D. 28 days. The answer is D. 175. Menopause occurs between blank and blank years of age. A. 30 and 40. B. 30 and 35. C. 45 and 55. D. 50 and 60. The answer is C. True and false. 176. Reproductive organs change with aging. The answer is true. 177. Diabetes and spinal cord injuries can cause impotence. The answer is true. 178. Heterosexual is a person who is attracted to both sexes. The answer is false. 179. Sexuality is important to small children. The answer is false. 180. Injury, illness, and surgery can affect sexual function. The answer is true. 181. Lochia means A. Person's feelings and attitudes about his or her sex. B. Surgical removal of foreskin from the penis. C. Vaginal discharge that occurs after childbirth. D. Incision into perineum. The answer is C. 182. Signs and symptoms of illness in babies include the following except A. The body is limp and slow to respond. B. The body has a low temperature. C. The baby is flashed, pale, or perspiring. D. The body has reddened or irritated eyes. The answer is B. 183. As a CNA, you can help with breastfeeding in the following ways. A. Helping the mother to a comfortable position. B. Making sure the mother holds the baby close to her breast. C. Having the mother use her nipple to stroke the baby's cheek or lower lip. D. All of the above. The answer is D. 184. Breastfed babies usually nurse every A. 8 or 12 hours. B. 4 or 8 hours. C. 2 or 3 hours. D. 3 or 6 hours. The answer is C. 185. Babies are fed on A. Schedule. B. Demand. C. All the time. D. On their mother's free time. The answer is B. 186. Safety measures for infants reduces the following except A. Laying an infant on soft bedding products. B. Support the baby's head and neck when lifting or holding the baby. C. Handle the baby with gentle, smooth movements. D. Use both hands to lift a newborn baby. The answer is A. 187. Nursing mother needs A. Spicy and gas-forming foods. B. Caffeine. C. Cola beverages. D. Good nutrition. The answer is D. 188. Infant birth weight is the baseline for measuring A. Weight. B. Growth. C. Height. D. Amount of milk taken. The answer is B. 189. When bathing a newborn baby, the water temperature should be blank to blank degrees Fahrenheit. A. 80 to 90. B. 90 to 95. C. 100 to 105. D. 100 to 150. The answer is C. 190. Which of the following is used to wash a newborn baby's nose? A. A knitted washcloth. B. Cotton balls. C. Alcohol swipes. D. A cotton swab. The answer is A. 191. CNA should report the followings to the charge nurse when caring for newborn babies except A. The baby has reddened or irritated eyes. B. The baby spit a small amount when burped. C. Stools are light-colored. D. The baby looks flushed, pale, and perspiring. The answer is B. 192. A baby's head and neck is supported for the first blank months. A. 9. B. 6. C. 8. D. 3. The answer is D. 193. When bottle feeding babies, you should A. Prop the bottle and lay the baby down for the feeding. B. Force the baby to finish the bottle. C. Hold the baby close to you. D. Leave the baby at 1 inch with the bottle. The answer is C. 194. Burping a baby is also called A. Breastfeeding. B. Bubbling. C. Diapering. D. Circumcision. The answer is B. True and false. 195. Newborns usually have a bowel movement with every feeding. The answer is true. 196. Watery stools means constipation. The answer is false. 197. Baby stops sucking and turns away from the bottle when satisfied. The answer is true. 198. You can lift a newborn by the arm. The answer is false. 199. Moisture, feces, and urine irritate baby's skin. The answer is true. 200. Umbilical cord carries blood, oxygen, and nutrients from the mother to the fetus. The answer is true. 201. A written plan listing the services needed by the person and who provides them is blank. A. Meal plan. B. ADL plan. C. A service plan. D. Nursing services. The answer is C. 202. Assisted living provides the following except A. Healthcare. B. Nursing care. C. Housing. D. Support services. The answer is B. 203. CNA should report any drug error to A. RN. B. Coworker. C. Receptionist. D. Doctor. The answer is A. 204. Medication records should include the following except A. The person's name. B. Date of birth of the person. C. Drug name, dose directions, and route of administration. D. Date and time to take the drug. The answer is B. 205. Which of the following is not drug error? A. Taking the wrong dose. B. Taking another person's drug. C. Taking a drug when ordered. D. Taking a drug at the wrong time. The answer is C. 206. Drugs are kept in A. Closet. B. On top of table. C. Under the bed. D. In a locked container, cabinet, or area. The answer is D. 207. Certain measures are needed when handling, preparing, and storing food. It includes the following except A. Empty garbage at least once in 2 weeks. B. Protect leftover foods. C. Wash cooking and eating areas. D. Place washed eating and cooking items in a drainer to dry. The answer is A. 208. CNA can assist with drugs in the following ways except A. Reminding the person it is time to take the drug. B. Giving drugs. C. Reading the drug label to the person. D. Opening containers for people who cannot do so. The answer is B. 209. Transfer, discharge, and eviction of persons can happen for the following reasons. A. The person fails to pay for services. B. The person wants to transfer. C. The facility closes. D. All of the above. The answer is D. 210. Housekeeping measures help prevent infection in the following ways except A. Cleaning tub or shower after each use. B. Cleaning bathroom surfaces once in 3 weeks. C. Dusting furniture at least weekly. D. Vacuum floors at least weekly and as needed. The answer is B. 211. When assisting with laundry services, you should A. Follow your own preferences. B. Wash with hot water. C. Follow care label directions. D. Wash sturdy and delicate fabrics together. The answer is C. 212. An assisted living resident is encouraged to eat in A. Dining room. B. Inner room. C. Bathroom. D. Kitchen. The answer is A. 213. Which statement about assisted living is incorrect? A. Assisted living provides secured and 24-hour supervision for residents. B. They provide each person with private apartment. C. 3 meals a day and snacks are provided. D. They offer social and recreational services. The answer is B. 214. Assisted facility residents have the right to A. Be treated with dignity and respect, consideration, and fairness. B. Help develop a plan. C. Receive the services stated in the service plan. D. All of the above. The answer is D. 215. Which is not a requirement and features of assisted living facility units? A. A mailbox for each person. B. A window that allows safe exit in an emergency. C. A closet with insects and rodents. D. Smoke detectors. The answer is C. 216. The excessive loss of blood in a short time is called A. Blood flow. B. Blood loss. C. Hemorrhage. D. Blood clot. The answer is C. 217. Blank occurs when the heart and breathing stop suddenly without warning. A. System arrest. B. Heart malfunction. C. Cardiac arrest. D. Heart stoppage. The answer is C. 218. The emergency care given to an ill or injured person before medical help arrives is called A. Initial aid. B. First aid. C. Last aid. D. Emergency aid. The answer is B. 219. When breathing stops but heart action continues for several minutes. This is called A. Respiratory arrest, B. Heart arrest, C. Heart seizure, D. Heart failure. The answer is A. 220. To activate EMS system, dial blank. A. 921, B. 112, C. 114, D. 911. The answer is D. 221. Which is one of the goals of first aid? A. To cure the person permanently. B. To prevent injuries from becoming worse. C. To operate on the patient if the need arises there. D. To make sure the person lives at all cost. The answer is B. 222. Causes of respiratory arrest include the following except A. Vomiting, B. Drowning, C. Smoke inhalation, D. Suffocation. The answer is A. 223. Which of these is not a general rule of emergency care? A. Check for life-threatening problems. B. Stay calm. C. Do not hang up until the operator has hung up. D. Act with alacrity and temerity. The answer is D. 224. The CPR has blank basic parts. A. 2, B. 4, C. 3, D. 5. The answer is C. 225. Which of these is not a basic part of CPR? A. Smelling, B. Airway, C. Breathing, D. Circulation. The answer is A. 226. Blank maneuver opens the airway. A. Nose tilt, B. Stomach tilt, C. Head tilt, chin, D. Nose tilt, chin. The answer is C. 227. The AHA's pediatric chain of survival involves these except A. Preventing cardiac arrest and injuries, B. Later advanced care, C. Early CPR, D. Early access to emergency response system. The answer is B. 228. When practicing CPR, we should use blank. A. Babies, B. Adults, C. Young people, D. Mannequins. The answer is D. 229. Cardiac arrest caused by heart disease is rare in blank. A. Adults, B. Children, C. Young adult, D. A and C. The answer is B. 230. Which of these can lead to cardiac arrest? A. Voiding, B. FBAO, C. Vomiting, D. None of the above. The answer is B. 231. A large, poorly chewed piece of meat is a common cause of blank. A. Syncope, B. Dying, C. Vomiting, D. FBAO. The answer is D. 232. Older people are at risk for choking. Which of these is not a risk? A. Strong fitted dentures, B. Poorly fitted dentures. C. Dysphagia. D. Hard candy. The answer is A. 233. Blank maneuver is used to relieve FBAO. A. Parkinson. B. Einthoven. C. Heimlich. D. Chest. The answer is C. 234. Blank results when organs and tissues do not get enough blood. A. Syncope. B. Shock. C. Convulsion. D. Cardiac arrest. The answer is B. 235. Blank is violent and sudden contractions or tremors of muscle group. A. Shock. B. Syncope. C. Heart attack. D. Convulsion. The answer is D. 236. Signs and symptoms of anaphylaxis are the following except A. Sweating. B. Shortness of breath. C. Voiding. D. Dyspnea. The answer is C. 237. Common causes of fires and burns include the following except A. Cautions with matches and lighters. B. Falling asleep while smoking. C. Fireplaces. D. Space heaters. The answer is A. 238. Blank is a sudden loss of consciousness from an inadequate blood supply to the brain. A. Stroke. B. Fainting. C. Cardiac failure. D. Angina pectoris. The answer is B. 239. Blank accident occurs when the brain is suddenly deprived of its blood supply. A. Cardio. B. Reproductive. C. System. D. Cerebrovascular. The answer is D. 240. The Heimlich maneuver is performed with people in the following position except A. Standing. B. Sitting. C. Walking. D. Lying. The answer is C. 241. A document stating a person's wish about health care when the person cannot make his or her own decisions is blank. A. Emergency directives. B. Later directives. C. Advanced directives. D. Healthcare directives. The answer is C. 242. Post-mortem means A. During death. B. After death. C. Before death. D. Death. The answer is B. 243. The belief that the spirit or soul is reborn in another body or in another form of life is blank. A. Resurrection. B. Ascension. C. Awakening. D. Reincarnation. The answer is D. 244. There are blank stages of dying. A. 5. B. 3. C. 4. D. 7. The answer is A. 245. During dying, a Mr. John responds and says, "No, not me." What dying stage is he in? A. Anger. B. Depression. C. Denial. D. Bargaining. The answer is C. 246. blank care focuses on the physical, emotional, social, and spiritual needs of dying people and their families? A. Hospital. B. Hospice. C. Covalent. D. Clinic. The answer is B. 247. Blank wills is a document about measures that support or maintain life when death is likely. A. Person. B. Living. C. Dying. D. Facility. The answer is B. 248. The dying person's room should have the following conditions except: A. The CNA arranged the room as they wish. B. The room should be comforting and pleasant. C. The room should be well lit and well ventilated. D. The room should reflect the person's choice. The answer is A. 249. Mrs. Smith is a dying patient and suddenly says, "This is not true. I know that I am dreaming." Which dying stage is this? A. Acceptance. B. Depression. C. Denial. D. Bargaining. The answer is C. 250. The dying person's Bill of Rights includes the following except: A. I have the right to be treated as a living human being till I die. B. I have the right not to be deceived. C. I have the right to die with somebody. D. I have the right to die in peace and dignity. The answer is C. 251. Restraints are used only if ordered by blank. A. Charge nurse. B. Doctor. C. Therapist. D. CNA. The answer is B. 252. When the dying person engages you in conversation, as the CNA, you should do the following except: A. Let the person express feelings and emotions. B. Do not worry about saying the wrong thing or finding comforting words. C. Ignore the client. D. Listen carefully and don't interrupt. The answer is C. 253. Dying people often need the following except: A. Hospital care. B. Nursing center. C. Hospice. D. Sports center. The answer is D. 254. The stiffness or rigidity of skeletal muscles that occurs after death is called: A. Postmortem stiffness. B. Rigor mortis. C. Mortem. D. Mortis. The answer is B. 255. Blank illness or injury for which there is no reasonable expectation of recovery. A. Sudden. B. Emergency. C. Terminal. D. Mortal. This has been CNA Exam Prep Volume 2, Nurse Assistant Practice Test Questions, written by Jane John Nwankwo, a registered nurse who also holds a master's degree in nursing. Narrated by Glenn Coster, Jr. Copyright 2015 by Jane John Nwankwo. Production copyright 2015 by Jane John Nwankwo.